Righty, well, we'll start. Bonjour tout le monde. Good morning, everyone. My name is Linda Barber, and I'm the branch manager of the Ottawa branch of the National Association of Federal Retirees. I'd like to begin this morning by acknowledging that the land on which the office is situated is traditional unceded territory of the Algonquin and Anishinaabe people. On behalf of the branch, I am very pleased to welcome you to today's webinar entitled Fall Prevention, a Head-to-Toe Approach, presented by Sarab Dormani. She's going to discuss the impact falls have on our health. She'll discuss preventative strategies, and she'll also look at some misconceptions too. Sarab is a registered nurse and co-founder and clinical director of the Natural Soul Wellness Center on Carling Avenue. Sarab worked as a critical care nurse in emergency for over 6 years and went on to complete her postgraduate studies with honors in advanced nursing foot care. As you'll see, she loves teaching, and she does this also through the Ontario Podortho Nursing Association, where she serves as vice president. Sarab focuses on patient empowerment and advocacy, healthy aging strategies, preventative care, and patient well-being using a holistic approach. Veuillez noter que le webinaire sera présenté en anglais, mais la participation bilingue est toujours encouragée. Now, I want to give a special welcome to anybody here who is not yet a member of the association. We're really hoping these webinars are going to inspire you to join us. And for all the folks who are already members, we hope these webinars, of course, encourage you to stay. I also want to make sure you know about the annual mega recruitment drive that's running until December 31st. Every time you successfully recruit a new member, you'll receive a ballot to win one of 14 great prizes, including $10,000 in cash from Johnson Insurance. And everyone who recruits a new member successfully will also get a $5 Tim Hortons gift card. There's no limits to the number of times you can be entered in the grand prize draw, so the more new members you recruit, the more chances you have to win. After today's webinar, we're going to send you an email with instructions on how to access the recording of the webinar, and we'll send you more information on the mega recruitment drive, how to join the association, and how even to give the gift of membership in the association, because don't forget, the holiday season's coming up. Now, I want to tell you that there's going to be a question and answer period at the end of the webinar, and all you have to do is type your questions into the chat box, and after Sarab's finished her presentation, we'll be reading the questions out loud, and she'll be answering them. So now I'm going to turn the presentation over to Sarab.
Thank you, Linda. So I'm just going to get the PowerPoint out here. There we go. Okay, great. Perfect. So good morning, everyone. Bonjour tout le monde. Thank you for joining us this morning as we talk about fall prevention. In our presentation today, we will discuss about the impact of falls on our health and wellness. Definitely, we'll be breaking some misconception and myths around falls and discuss a couple of fall preventive strategies so we can all remain strong on our feet. So just a quick disclaimer, this presentation is intended for educational purposes only as an overview of some health-related topics, specifically to falls. It is not intended to replace any medical advice, and the information that I share with you today are of my knowledge, experience, education, research, and skills. And the content of the presentation today was created in guidance with resources from Ottawa Public Health and the Public Health Agency of Canada. So please note that I have no affiliation with these organizations. They do not pay me any money. And if you need any advice about a specific medical concern, please speak to your primary healthcare provider. So just a quick background about my professional career as a nurse. So I've been a registered nurse for 10 years with a background in the emergency department. So you can imagine that during the years that I've worked in the ER, I have cared for many fall victims. We've had patients coming in for very simple injuries, but we had also patients coming in for more altering traumas, such as head injuries, hip fractures, and things that really changed their quality of life and the way that they were recovering. And every time I would have a patient coming in for a fall, I would always ask myself, what could we have done to prevent this? Obviously, I wasn't at the scene of the fall. I'm there for the aftermath, but it always struck with me of like, oh my God, what could we have done? I'm also a fall victim myself. A couple of years ago, I sustained a a leg injury after a fall, and the recovery was very difficult, and I ended up with other conditions that just delayed my recovery even more. And I saw how much that injury impacted my life and affected me in so many ways. And I was unable to go to work. I was unable to drive my car. I was unable to take care of my kids or to do any physical activities or leisures. So that definitely affected me a lot. And however, it was my injury that inspired me to specialize in foot care and start my own practice and co-found my clinic, Natural Soul Wellness Center here in Ottawa. And I'm proud to say that I've learned a lot from that experience, and that our clinic uses a holistic approach to addressing health and wellness by offering a variety of services. So we don't just do foot care. We do offer massage, reflexology, acupuncture, skincare, a lot of really, really great services to help people stay healthy on their feet. So being a registered nurse specialized in foot care, I focus a lot on prevention when I provide care. And it might not seem directly like obvious that what I do helps with fall prevention, but it does, because we do prevent a lot of foot complications. And by helping to prevent foot complications, we do also help prevent falls. So just quickly, here's a list of what I do. So being a nurse, I offer consultations, assessment, plan of care. I do offer advanced medical foot care and medical pedicures. So if you do have any corns, calluses at the bottom of your feet that could cause some pain at the bottom of your feet and forcing you to shift your gait and balance, having that taken care of can prevent a fall. If you have thick toenails, and having that properly cared for can also help prevent any foot complications, prevent a fall. Diabetic foot screening and care. We provide a non-invasive approach to ingrown toenails, fungal toenails. If you have bunions, hammer toes, arthritis, any concerns with the aging foot, you want to make sure that you still have a solid foundation. So there are definitely a few digital devices that we can include there to make your feet a lot more comfortable. Preventative care as well is very, very important. I also am certified in compression therapy garment. And when you have swelling in your leg due to vascular conditions or lymphedema, having one leg larger than the other can increase your risk of falls, because then you have a lot of fluid buildup and a lot of extra weight in one limb, and it can definitely shift your balance and gait. Footwear assessments is another very important one as well, because having a good pair of footwear can also prevent falls. Wound care assessments. So if we have patients with diabetic ulcers, they're also more at risk of falls because they have a wound under their foot. And I do work with a team of other practitioners to help manage pain, and also providing biomechanical assessments, gait scans, where we can see how you walk, how you stand, your posture, your balance, all to really help you remain strong on your feet. But we'll discuss a bit further the importance about foot health in some future slides. So here are a few facts and statistics related to falls. So falls can happen to any age group. I've had a fall. But however, they are the leading cause of injuries among seniors. And 1 in 3 seniors will fall annually. But what's concerning is that after a fall, seniors will typically stay an average 10 days longer in the hospital compared to any other age group. Falls also cause 85% of senior injury-related hospitalization, which is a very, very high number. And 95% of hip fractures are caused by falls. What makes it a bit more difficult in terms of the recovery is that 30% of long-term care admissions are due to someone having a fall and not being able to go back to their house. In Ottawa, emergency department visits, the latest numbers that I have are from Ottawa Public Health. Back in 2017, it was estimated that just in our city, we had over 8,000 visits related to falls in our ER. But just know that all of the numbers that we've just mentioned above is an underestimation, because unfortunately not all falls are reported. Unfortunately, there are a lot of misconceptions and stigmas around falls. No one expects to have a fall, but it's really important to have open conversations about it. So thank you for being here and wanting to learn more about how we can prevent falls, because I know it's not always an easy discussion, and I can see it in my practice that it's not always easy for my patients to open up about it, but it's definitely important to know the facts related to falls. So I wanted to share with you 5 myths that I've heard the most in my career from my patients and their surroundings. So number 1, people say that, oh, well, we've had a fall, it's normal, you know, it's part of aging. And this is false, because no matter your health, falls are not a normal part of our lives. And there's definitely a lot of steps that we can do to prevent falls, and we'll discuss further about that. Another one that I heard is, if I stay home, I won't fall. Again, false, because statistics show that 50% of falls happen within the person home. Unfortunately, there are a lot of hazards around our house that can actually cause falls. Another one is, I won't fall if I don't move around too much. Again, false, because being active will actually allow you to stay stronger, flexible, and help with your range of motion and balance. The less you move, you are going to have some joint stiffness, you are going to have some muscle weakness, your balance won't be as good. So it's definitely important to be able to move around. But then in relation to that, I've also heard people saying, well, I lost my muscle strength and there's really nothing I can do. And again, false, it's never too late to start being physically active. If you haven't been active for a while, you just have to be patient and you can get back to it. But muscle strength is something that we regain gradually. And the 5th myth is, I've had my foot pain for years and it's normal to me. And again, pain is not a normal part of aging. Foot-related problems can actually increase the risk of falls. So having your feet taken care of by a medical professional specialized in foot care can actually improve your ability to move. All right, so falls can be caused by different factors, and we categorize them in the following. So we have physiological and health factors, we have behavioral lifestyles, social, and environments. We will just quickly go through the different factors. So in health factors, if patients have impaired mobility, trouble with their gait, balance, and strength, it can definitely put them at risk of a fall. Poor eyesight and not being able to see very well, or having hearing impairments, can also increase your chance of falls. With hearing, it's because your balance is in your inner ear canal. So that's definitely important to have your hearing checked. Acute illnesses. So if you're recovering from an infection, a fever, an injury, or a wound and an ulcer, it can definitely, increase your risk of falls. But often with acute illnesses, we also have new medication and we're just trying to get used to the side effects of those. So that can also impact us. Having a chronic condition such as stroke, Parkinson's, diabetes, osteoarthritis, vertigo, osteoporosis are other factors. And definitely foot disorders such as neuropathy, pain to the legs, and swelling. With behavioral factors, we also notice that the history of a fall is one of them. So if you've had a fall in the past, chances are you are more at risk of having another fall. And the fear of falling is another one, because if you've had a fall before, you might feel a lot more anxious, a lot more worried about doing certain things that did cause your fall in the first place. So that can, and having that fear can maybe have you not move around too much, not go out too much, which we saw in the previous slide, the myths that it can increase your risk of falls. Medication. So if you're taking medication for your blood pressure, I have sometimes patients that have a couple of medications for their blood pressure. And if you take it all at the same time, then your blood pressure can actually dip a lot lower. These medications also affect your heart rate. So that can bring your heart rate down and it can cause some dizziness, some vertigo. Sedatives are another one, laxatives, diuretics, because we have the urge of going to the bathroom. And then having that sudden urge and not being too conscious about the way that we're moving can actually increase our risk of falls. Antidepressants do have some side effects that can increase falls, and as well as over-the-counter medication is something that we have to be cautious with because some of them do have sedative side effects. Being inactive, sedentary, if you're coming back from the hospital and you're recovering from that, chances are you're feeling a lot more weak. Poor nutrition and sleep, alcohol and recreational drugs are also another factor. Living alone, having the lack of a supportive network, unsafe living conditions, lack of awareness in the community, because if we don't talk about it, we don't know it, then we can't really do much to prevent it. Lack of transportation, not being able to maybe access to a transportation to go to a community center to stay active, not having assistive devices, such as if you need a cane or a walker, and different amenities. I've added COVID-19 restrictions because I know that the last 2 years have impacted our senior population with the different restrictions and the ongoing fear of the pandemic. Although a lot of the data that we have about falls is from before 2020, I can just tell you that listening to my patient and caring for them, there's been an increase of falls in our community. And I'm curious to see when those new numbers are going to come out. But by having restrictions where we had to close our pools, our gyms, our community centers, recreational facilities, and having people less active, less mobile will have definitely affected their strength, their balance, the lack of social activities, the fact that patients weren't able to see their family doctors and have proper medical follow-ups, or having medical appointments for their eyes, their ears, their physical therapists, their physiotherapists. These are all things that definitely affected us. Not everyone, unfortunately, was able to have access to the different virtual activities that were available. Not everyone has a computer, not everyone has internet, and even if you did, is your living room or your home, safeguarded for you to have a physical activity and to move around safely, like you would have, at a gym or a community center. So definitely these restrictions have caused a general weakness in our population, and we've definitely noticed just from our personal patient care that there has been an increase of falls in the community. And last but not least, in the environmental factors, there are the risk of having obstacles, tripping hazards such as rugs, cords. Stairs are another big one. So when you're in the stairs, it's not the time to start texting or having an important conversation. Just go up and down the stairs so you're out of your staircase as safely possible. Home hazards, so poor lighting, not having any grab bars, poor property maintenance. So depending if you're in an apartment building or a condo or things like that, you want to make sure that you have a good landlord that always makes sure that the hallways and the outside of the property are well taken care of. And our amazing winters here in Ottawa, where you sometimes get all 4 seasons in a day with rain and ice and snow, those conditions can increase the risk of falls. And I can tell you, when I worked in the ER, and if there was a freezing rain, I would be having people coming in, slipping off the ice with different injuries for most of my shift. So falls can be caused by one of these factors, or it can be caused by a combination of these factors. So what are the effects of falls? And this is where it's important to have the open conversation about the effects of falls. So we know that falls can affect our mental health and cause emotional stress. The recovery can be quite difficult and can lead to isolation. Depending on the kind of injury you've had, you can have a loss of independency. You can have reduced mobility, and sometimes it can leave you disabled. We saw earlier that it can force an admission to a long-term care facility. So if you are living with a partner and then you have to move into a home and then your partner still stays in the home, then that's, you have to think, oh, that is actually mortgages, basically. You know, it's definitely causing a financial burden if you are unable to work and bring in an income, if you are wheelchair bound and you have to think of modifying your home. These are all things to consider. There's also the risk of having pneumonia, urinary tract infections, and wounds, because the less we move, the more we are at risk of developing pressure ulcer sores and infections. As mentioned, there is the increased risk of falling again. Hip fractures is another one, and there's also the increased rate of mortality if you were not able to recover from your injuries. So how can we avoid falls? Well, we just saw in the previous slides that falls are multifactorial, so it does take a multidisciplinary approach to address falls. And the good news is that falls are preventable. So just generally speaking here, if we talk about your health, what we recommend is having your vision and your hearing checked regularly. So make sure that you're always up to date with those appointments. If you're a diabetic, it's important to have your blood sugar checked regularly, because low blood sugar or even very high blood sugar can lead to, blurred vision, dizziness, vertigo, and if ever you do lose consciousness, depending on where you are, then you would have a fall from that and have an injury. As we saw the complexity of medication, it's important to have your medication reviewed by either your family doctor or your pharmacist. So if you're not able to get in to see your family doctor, use your pharmacist. They've studied pharmacy medication. They'll be able to look at your medication with you, see if there are any side effects. You know, are there some medication that are making you drowsy and dizzy? Well, then don't take those in the morning. Take those in the evening before going to bed. Are you on a lot of different medications for your blood pressure? Then maybe there's a way to space out those medications so you don't take them all at the same time, that you take them at different times of the day so it doesn't affect your blood sugar too much. If you are on diuretics and it's the medication is making you run to the bathroom, well, that's not something you're going to take before bed, because the last thing you want is to running through the bathroom at night when it's dark. So these are all things that you can look into with your pharmacist as well. If you're on blood pressure medication, it's important to just have a little blood pressure monitor at home and making sure that your blood pressure is okay when you take those medications. If you have any mobility assistive devices, such as a cane or a walker, definitely use them. When I have patients with walkers and they come into the appointment without their walkers and they're like, oh, I left it in the car or at home. And I'm like, why? You need this. So definitely use them. Nutrition is important to stay hydrated, not to skip meals so we don't start playing with our blood sugar and cause any dizziness, making sure that we have a balanced, nutritious meal. A great supplement is vitamin D to help with strong bones, calcium, just to prevent fractures. And always remember that healthcare is a multidisciplinary approach. So whoever you have in your healthcare team, not just your family doctor, but if you have a great physiotherapist, a chiropractor, a nurse, anyone that can really, really help you stay strong on your feet, take advantage of that. So speaking of feet and staying strong on your feet, being a foot care specialist, I will definitely recommend checking your feet on most days to make sure that you don't have any blisters, corns, calluses, or any infections or anything abnormal that you need to have addressed and assessed immediately by your foot care specialist. Because these concerns, such as corns, calluses, painful toenails, leg pain, swelling, and so on, can impair the way that you walk. Sometimes I'll have a patient coming in and say, oh, I have pain to my right foot. And then I do an assessment and I see, well, they have a lot of dried skin and calluses build on the opposite foot because they've been compensating this whole time. Well, this is not good because now they ended up with other issues on, the healthy limb. But that's not, we need to address things the sooner the better. There's also neuropathy. So neuropathy is a condition that causes a loss of sensation and nerve damages, and it can affect our diabetic population, our population going through chemotherapy, our population going through surgery. And that can also increase your risk of falls, because if you do have poor sensation to your feet or a loss of sensation. Some of my patients don't feel their feet at all. That below the ankles, they have no sensation. So when they're walking, they just, I guess I can't really explain it how they explain it because it's so mind-blowing, but they just don't feel their feet when they put it on the ground. So definitely that is increasing your risk of having a fall if you can't feel what is holding your entire body up. But the other concern with neuropathy is that if you do not have any sensation to the bottom of your feet, if you step on something, an object, you won't feel it, which could cause, a trip and a fall, or that object can cause an injury under your foot and you won't know it. And then you can end up with a wound, an ulcer, and it can progress to something a lot more drastic. Well, we can't talk about feet without talking about your true soulmate, which is your footwear. And our footwear play a very, very important role in preventing falls. And as I mentioned, in Ottawa, sometimes we go through all 4 seasons in one day. So it's important to have footwear that can accommodate our seasonal changes. However, indoor footwear is as important as outdoor footwear because, as we saw, more than 50% of falls do happen within the person's home. So it's important to have safe footwear as well. Often I have patients that are like, oh yeah, I still have my slippers from many, many years ago. And I can just imagine what those slippers look like. And I can just imagine that those slippers can actually risk more of a fall than preventing one. So footwear is very, very important. You have to make sure that you are having shoes that are comfortable, that offer support and stability, that have room for your toes to move, so it shouldn't feel all squished in the toe box. Slip-resistant footwear and sandals and slippers are great to have. They need to be well fitted. You don't want them to be too big so your foot slips out of it, but you also want to make sure they're not too tight. Good floor contact through the sole and a good arch support as well. And on the picture below, you can see this is just an example of a gait scan that we do at our clinic to see when you stand and you walk, what are the pressure points on your feet and how your foot contacts with the floor. So that is also a great tool that we can look into to helping you stay strong on your feet. Of course, as mentioned, we want you to stay active. So remaining active does reduce the risk of falls. It helps us have stronger bones, stronger muscles, flexible joints, just more energy, better sleep, improved mental health, and it's a great social activity. So it's important to find an exercise that provides you strength and balance, that helps you build endurance and flexibility, and to do an exercise within your comfort level, such as walking, gardening, swimming, tai chi, just to name a few. I don't have really, really good knees, so things like jogging and running are, why would I put myself through it? I'm not going to enjoy it because I'm just going to feel all of my joints from the impact. So I choose to walk or to do more of a power walk because that's what's comfortable for me. And that's really, really important to find something that's modified within your comfort level. If you have any assistive devices, such as a cane or a walker, find an exercise program that allows you to integrate your cane or your walker into your exercise routine. There are so many great exercises out there, and the one that I recommend to a lot of my patients is activities in motion, so AIM Fitness, because I know that they have a lot of great programs for adults 55 and over, and they do also integrate a lot of really great fall prevention programs. And these activities can be done either virtually or in person, so definitely a great exercise program here found in Ottawa. So quickly, we'll talk about your environment as one of the factors that can that we can help to prevent falls. So when walking or getting out of bed or from the chair, we recommend that you just take your time and you stand up slowly. You're in no rush. This is also mainly because sometimes when we get up too fast, our blood pressure can drop and it can cause some vertigo and some dizziness. And just those couple of seconds of you feel like you're dizzy, you don't know where you're grabbing, you can definitely have a fall and injure yourself. When you are going up and down the stairs, take your time. But like I said, the staircase is not the time to start having important conversations or doing important tasks. Just get out of the staircase. Indoors and outdoors, if there are any handrails or grab bars, use them. They provide extra support if you need them. This is a good thing to look into to add them within your home. Stairways and walkways should always be free of ice, snow, rocks, grass, and clutter. So if you are in an apartment building, a condo, and these are things you need to point out to your landlord, go ahead, definitely talk about that. Have your home verified for tripping, slipping hazards, such as rugs, cords, anything that can, all of a sudden get caught in your feet and cause a fall. It's important to improve the lighting in your hallways, your staircases, and outdoors when you're going out to throw the garbage, or if you're waking up in the middle of the night to go to the bathroom. Statistics show that most falls happen either in the staircases or when people get up to go to the bathroom at night. And I can tell you, in my experience in the ER, we did have a lot of visits in the middle of the night where people got up to go to the bathroom, had a fall, but unfortunately weren't found for a couple of hours later. Install a chair or a seat in the shower and the entrance when you wear your shoes, so you don't have to, worry about jumping on one leg to put your shoes on. Be careful with cleaning products for the floor because some of them can make the floor very slippery. And look into non-slippery surfaces such as rugs, mats in the bathroom floor, but make sure that there is sort of a silicone suction under the rug so it stays on the floor and it doesn't move around, because we don't want that to cause you a fall either. Most importantly, ask for help. Your voice is very, very important. And as I mentioned, if you need help to prevent a fall or you've had a fall, we really, really need to talk about it. The more we talk about it, the more we're aware of it and the more we can just better live our lives. So if you have friends and family, neighbors, people love to help each other. So this is definitely a great way to ask people to come and help rearrange your furniture and to secure rugs. Your home safety can be verified by a trained professional. Some physiotherapists and occupational therapists offer either ergonomic assessments or home visits. And if you have insurance coverage for that, take advantage of it. Just have someone come into your home and just to make sure that it's safe for you. Wellness check. This one is very important. So having a friend or a family call you at the same time every day. And the reason why I say this is because we've had a couple of visits in the ER where people came in after a fall, but they weren't the ones that called 911. It was a friend or a family, because at the same time every day, that family member would give that person a call. And that one day that person did not pick up the phone, they knew something was wrong. So they immediately called 911. And 911 came and saw that this person was on the floor, had a fall, wasn't able to get back up, wasn't close to a phone, didn't know what to do. So they immediately brought them to the hospital in less than a couple of hours. We were able to take care of them, and it just saves a life. So it's definitely great to have that system in place. With Ottawa Public Health, there are some really great self-checklists out there that I'll show you quickly, where you can just check around your home and see if you do have any thing that can increase your risk of falls and what you can do to prevent it. You can talk to your healthcare team, either your family doctor, your nurse, your physiotherapist, your chiropractor, anyone out there, to do an assessment and to see if you are at risk of falls with just your mobility, your balance, things like that. And there are definitely some community fall prevention programs out there in the community to look into. Fall alert systems are another one. So just a quick picture over here. On the left, this is just the device that you wear around your neck. And again, a couple of ER visits came in for this. This little device had saved their lives because they had a fall and then they weren't able to get up. But if they had lost consciousness, then they weren't able to answer because there's basically an alarm from that. So if you have a fall, there's a voice that comes in and it's saying, are you okay? Can you hear me? If there's no answer, if they're not able to communicate, they know something's wrong. So right away, there's a direct dispatch with 911, and then the paramedics come within the person's home. So this little device had definitely saved people. And then here on your right, just a quick checklist from Ottawa Public Health, what it looks like with removing hazards around your house. And if you've had a fall, well, then report it. We need to talk about it. Even if you're not injured, it doesn't matter. Talk to your primary healthcare provider, tell someone you trust, talk to a member of your healthcare team. Why? Because we need to know what is the factor that caused your fall and what can we do to prevent it in the future. If you're in a public area, then report your fall to your municipality. Just like you would if you're on the road driving and you see a road hazard and you're like, oh my God, this could cause a car accident, you would report it to your city. Well, the same thing with wanting to prevent a fall and reporting it to your city as well. If it's a work-related injury, then a work-related incident report needs to be filed to address the issue immediately and in hopes of preventing an injury for anyone else in the future. With Public Health Canada, there's some great documents called If You Fall or Witness a Fall, What Do You Do? So this is a very detailed document of what do you do if you have a fall and you can't get up? What do you do if you have a fall and you cannot get up? And what do you do if you witness a fall? So it really, really breaks down the these different scenarios and helps you look into it. I unfortunately am a bit short on time and I can't look into it too much in details, but it's definitely a great read. So falls among older adults unfortunately continue to be a serious public health, and hospitalization and mortality rates are on the rise. And I know that the last 2 years have given our communities so many challenges. So no more than ever, we really, really need to be with each other and need to have each other and to help each other out, have open conversations about preventing falls and breaking the ongoing stigma. Preventing falls can save a life. We often think of like, well, I haven't had a fall. I don't need this information. Well, no, but you can just learn and prevent a fall for yourself or for a loved one or for an elder parent, a neighbor, anyone. I know a lot of people that had falls have a hard time opening up about it. They're embarrassed about it, but just know you're never alone and don't let the fear of falling keeping you from being active into living your life to the fullest. As we mentioned, safety first. So look into you, your health, and also your home. And if ever you need an assistive device, it's okay to have one and to use it to help you move around safely. As mentioned, we talk about it, let's ask for help. You speak to your team of different healthcare professionals. The more we talk about it, the more we have stories to share. We can learn so much from each other. We can help each other out. When I have patients that share me their stories, you know, I'm very sensitive to my patient's journey. I've learned a lot of great things from books and research, but it's really my patient's journeys that really build my career, because I learned so much from them. And if they tell me something and then the next person comes and tells me something similar, I can be like, oh, well, I've learned this from that patient and it worked from them. So this is really how we get the conversations going. There are community groups and online resources that I've just included below. So parachute.ca is a Canadian website, and they have close to 30 resources on fall preventions for seniors. So a lot of really great resources that also include resources from Public Health Canada on there. And there are a couple of really great documents too from Public Health Canada, such as if you witness a fall, what do you do? How can you prevent falls? And the Safe Living Guide and a guide to home safety for seniors. This is a 21-page document that goes through all of the factors we just mentioned in the earlier slides. And there's a checklist that you can basically just do like a self-screening assessment if you wanted to on how you can prevent falls, detect hazards, and be like, oh, okay, well, this one I didn't check off, and I should probably make an appointment with this person to have it checked. So this brings us to the end of our presentation on fall prevention. I want to thank you for joining me today as we talk about promoting healthy aging, creating healthy environments, collaborating and supporting each other in our efforts to prevent falls. And I also want to thank you, the NAFR, for inviting me again to be able to talk about this topic. So I will now take your questions.
Thank you so much, Sarah. That was really, really helpful. We do have some questions in the chat box, so
Okay, perfect.
I'll start to read them out, and feel free to add other questions as we go. Now, the first one is, what is the importance of calcium and vitamin D in building strength and preventing falls?
Well, those are supplements that help with ensuring strong and healthy bones. So definitely with that, we can prevent conditions such as osteoporosis, because if you do have osteoporosis, we know that osteoporosis is some weakness with the bones. So if ever you do have a fall and you do have osteoporosis, then you're more at risk of having a fracture, which can be very, very difficult to recover from. So having a good balanced nutrition is important. The other thing with vitamin D and calcium is when you take supplements, you don't just take the vitamin or the mineral by themselves. It's really the combination of taking these supplements together that can ensure that they're well absorbed in the body.
Excellent. So the next one is, what are your tips for preventing a fall in the winter? Or if you're going to fall, any suggestions on how to brace yourself for the impact? And I can attest that the bracing that I did when I had my big fall didn't work at all, and I broke my wrist.
Yeah. Winter conditions are very tricky because, I mean, is it snow? Is it ice? Is it snow over ice? Is it freezing rain? Definitely, if the conditions aren't safe for you to leave your house, then I don't recommend you maybe just making some rearrangements in your appointments. If you do have a fall in a public area outside, the important thing is really to stay calm. Now this is, you've had a fall and you're conscious, because at some point, you know, the unfortunate can happen, and we're just in hopes that there are witnesses out there that can come and help you out and someone can call 911. But let's say in a perfect scenario where you had the unfortunate event of having a fall, but you are conscious, you didn't hit your head, just really to stay calm, take a minute, and just see if you are able to move some of your limbs. Now, if you have a limb that is painful, where you're like, oh, I don't know if I broke this or what's going on, then it's important to not to roll on that side, but to roll more on your stronger side, and have your stronger side help you give a bit more of a push and a grip up. When you are getting up from a fall, don't think of getting up right away. Let's think of just, are we able to roll? Are we able to at least just sit? And then if we're able to sit, what are we able to do? Because sometimes if you're not able to get up, at least if you're able to sit, you can reach for your cell phone and then call for help, call 911 if you're by yourself. If you're able to, and you want to do things slowly again, because you don't know if you're getting up too fast, if you're going to feel dizzy. So definitely a few things to look into, taking it step by step. But I know that the document that I've included does go a lot more in detail about how to get up from a fall.
And in terms of bracing yourself, if you're going to fall, any suggestions about that?
Again, it's just difficult, like in terms of you know, where is this happening? Like, is it happening and in a staircase that's slippery? Well, you know, you have handrails, but it's happening on the sidewalk. Then there's not really any assistive devices to help you. But if there's snow versus ice, you know, snow is a lot more fluffier than ice. So, but again, these things can happen so fast. So it's
It's tricky.
It's pretty difficult.
Sure.
It is tricky. I mean, I can draw you the perfect scenario. Is it going to happen?
I remember my husband said I should have rolled another way, and I kept thinking, well, I had no control at the time of rolling any which way.
Yeah. I mean, I can just quickly mention about when I had a fall and how I braced myself. It was during an exercise and I had weights, and I knew that I was falling. And I had weights on, I had about 40-pound weights on my pelvis. And I was like, okay, if I fall this way, these weights are going to crush my pelvis, and I don't want that to happen. So I kind of shifted to fall backwards and let the weights, I just wanted to get rid of the weights so they didn't injure my body. But when I fell backwards, my right leg had a mind of its own went into a different direction and caused the injury. So I guess I chose the best of the worst scenario possible. So it's just one of those things.
Yeah, and the window for making any kind of a decision is pretty slim.
Like half a second.
Now here's another question. Do you recommend a mat in the shower?
Yeah, so having a good silicone mat, again, not just a good quality silicone mat that has like the silicone suction that stays is definitely good, and make sure that it's not the ones that are like shiny, because you don't want to add any more slippery surfaces to your shower. So that's something to look into, but it's not a bad thing to have, especially if your shower floor is slippery.
Okay, how about the strap-on spikes for icy conditions? Do you recommend those? Do you have any? Is there any brand you clearly?
I'm not too familiar with the specific brands, but that's actually a good one that I was thinking of when we were talking about winter conditions, is adding those to your footwear, especially if there are some icy conditions out there. There's definitely a lot of recommendations to having that. So that I would make sure I would get that from a store where you can actually go in and talk to someone and have it well assessed and make sure that it's fitted to your winter boots, to your shoe. Sometimes it's just good to go in store and to talk to someone rather than trying to find what's out there in the online stores. So it's just, you get the right product for you.
Yeah, we walk dogs every day and we strap them on all the time.
Yeah.
Now here's a question kind of specific to your services at the clinic. The member's asking, which of the following health insurance services does Natural Soul fall under? And the person has suggested, is it naturopath, osteopath, podiatrist? Would you know?
Well, at our clinic, we offer a lot of different services. So my services specifically, I'm a registered nurse. So my care falls under nursing care because it's my license number with the College of Nurses of Ontario that is on the receipts that you can use for your insurance or for your income taxes.
Okay, so they really get in touch with you.
Oh, yeah. And I mean, we do offer like acupuncture, reflexology, chiropractic, massage therapy. That's all under their own colleges. So it's depending which service you get under which registered body.
And another question, would someone need a doctor's referral or not to consult you?
So again, that's for insurance purposes. All of our services are self-referred. You don't need a physician's prescription to come and see us, but if your insurance company requires it, then you can get one either before or after, or we can always fax one to your family doctor as well, because we have referral paths that are already pre-made.
Excellent. Thank you, Sarah. I think that's the end of the questions. That's what it looks like
great
to me.
Questions.
Yeah, absolutely. And I have to thank you personally for talking about this as a normal routine thing, because for years I didn't ever speak about my fall. And I was embarrassed, and it's taken me a long time to get my confidence back. So I think it's really good to have this kind of conversation. So thank you again for doing this for our members.
Perfect. And I've just left my email. So if you think of any questions afterwards and you want to send me an email, my email is right here on the screen.
Yes, what we'll do, we're going to send everybody a follow-up email. Antoine will do that, and he'll explain how to access the recording from today and how to look at the slides. And he'll provide your follow-up contact information so people can get in touch with you. And we'll also talk about other webinars, because of course we've got more webinars coming up. And even with AIM Fitness that you mentioned, because we do AIM Fitness, Meg Stickle-Craker once a month does virtual fitness classes that people can participate in from their homes. So please check our website, and you can see what's coming up next and register to attend. Reminder to everybody that you can invite non-members to attend our webinars, and they can try us out for free. And again, we hope maybe they'll decide to join us, because this is the only way our association can grow. And we'll make sure, as I say, to put all these goodies in the follow-up email. So, oh, and don't forget the mega recruitment drive and the prizes. I have to say that. Anyway, I hope you all have a wonderful day. Thank you again, Sarab. And we'll look forward to seeing all of you at our next webinar. Merci beaucoup et au revoir.
Bye. Thanks.